Hello everyone. So we have a 34-year-old man and he has come to the emergency with severe abdominal pain. It is located in the left abdomen and radiates to the groin. And he vomited twice when it began. Mucous membrane is slightly dry. Extremities have no cyanosis, no clubbing, no edema. Most appropriate test to diagnose this patient condition is, well, the answer to this question is abdominal ultrasonography. This patient has severe left lower abdomen pain radiating to groin. This is a classical feature, okay? Loin to groin radiation. This is a golden line to remember. Loin to groin radiation is most likely due to ureteric stone. Okay. Well, he also had, and vomiting can be a associated feature. And when you are examining the patient, you are not finding any abnormality. It is typical feature of obstructive ureterolithiasis. So remember, golden line to remember, loin to groin is obstructive stone in the ureter which is causing obstruction. Acute obstruction of the ureter at the ureterovesical junction produces severe flank pain that radiates to perineum, penis, scrotum or inner thigh also. Well, you can see ureteric calculi and it has led to hydronephrosis also. You can see, compare the size of calyces on both sides. Some stone is there which causing hydronephrotic changes are there. Okay. Patients with ureter stone are often writhing in pain and are unable to sit still in the examination room. Our patient, he has difficulty lying still on the examination table due to the discomfort. Again, additional feature which really supports ureteric stone. Obstruction of any hollow viscus often produces severe pain in abdomen that is colicky in nature and poorly localized, that doesn't radiate to loin to groin. Other causes of severe visual pain include obstruction of small intestine, colon, common bile duct stone and urinary bladder problem. Each of these produces a characteristic pattern of referred pain. Okay. Now, we have clinically we made a diagnosis of ureteric stone. So now how we diagnose? We have following method. One is ultrasonography. Second is non-contrast CT scan of abdomen and pelvis. So we have two important modality. Out of this, first is ultrasonography. This provides a good imaging of the kidney and the proximal ureter and has a lower radiation exposure also, rather there is no radiation to be more precise. It is preferred in patients with low likelihood of alternate diagnosis and in pregnant patient. Definitely in pregnant patient we are not going to expose to CT scan. However, it can miss some small stone and it all depend who is doing. It's a matter of subject also. So now regarding abdominal X-rays. X-rays of KUB, kidney, ureter, bladder study. This will identify only radio-opaque stones like calcium-containing stones. Definitely other stone like there's 15% stone are not visible because they are radiolucent stone. And this can also miss small stone, especially at the ureterovesical junction. X-ray give no information about obstruction of ureter or kidney also. However, it may be useful in serious follow-up stone in the kidney or renal pelvis. If you want to have a serious, then it's a good option. CT of the abdomen or pelvis with contrast. Contrast is not required to visualize ureteral stone. A non-contrast CT of the abdomen and pelvis can be obtained quickly. It's very sensitive and specific. But in our question, they are talking about contrast. We don't use contrast at all. So this question already ruled out. So we are talking about non-contrast CT scan. It can even visualize small or non-calcium stone also. Those stone which are radiolucent. Radiolucent stones can also be seen in this. It may identify other potential cause of abdominal pain also. Intravenous pyelography uses IV contrast and pelvic X-ray to visualize the urinary system. IVP was previously the best option for diagnosing urinary stone. Now, however, the risk of contrast, administration, allergy, acute kidney injury, so non-contrast CT scan is preferred over IVP. Urine analysis and culture will show microscopic or gross hematuria in 90% cases. However, hematuria is non-specific. There are n number of causes of hematuria. It is important to exclude coexisting urinary tract infection with urinary calculi, as this will significantly change the management. This patient has no history of fever, dysuria. He is afebrile. The UTI is ruled out. Well, now I can show you some of the stones. This is calcium-based stones. White stone, which is mainly a phosphate stone, uric acid stone, and cysteine stone are shown. Golden line to remember: urethral calculi may cause flank or abdominal pain radiating to the perineum, often with nausea and vomiting. Ultrasonography or non-contrast spiral CT of abdomen or pelvis are imaging modality of choice. This is the first choice and this is the second choice. Ultrasonography is preferred in pregnant patients to reduce radiation exposure. Thank you very much.